The Evolute heart valve is a treatment option for people with severe aortic stenosis that does not require open heart surgery. Severe aortic stenosis occurs when the aortic heart valve does not open and close properly due to excessive calcium buildup. This makes your heart work harder to pump blood through your body and limits your normal daily activities. Before the procedure begins, you will be given anesthesia or sedation to make you comfortable. The entire procedure typically lasts between 1 to 2 hours. The arteries in your body are like a system of roads that branch out from the heart. There are different routes that your doctor can use to implant the Evolute heart valve, and all come with their own individual risks. So speak with your doctor about what route is best for you. These routes include an artery in your leg, an artery in your neck, a space between your ribs. In a typical Evolute procedure, the doctor makes a small cut at one of these access points and guides a thin, flexible tube with the heart valve into your artery and up to your diseased valve. When the heart valve reaches the diseased valve, the features of the Medtronic Evolute heart valve allow your doctor to reposition the heart valve to assist in accurate placement. Once in place, the self-expanding frame of the Medtronic heart valve enables your doctor to deploy it in a controlled and accurate manner. After expanding, the new heart valve takes over the old valve's function to help blood flow efficiently out of the heart. Once the valve is accurately placed, the thin flexible tube will be removed, the cut will be closed, and the procedure will be complete.